Hey everybody, welcome to the Airway Mini Residency 3.0 Airway Nexus podcast. And I am really excited today to be our moderator. Dr. Cruz is spending some quality time with his son in Utah, and I'm here in Los Angeles. And my special guest is Dr. Barry Raphael, and he is on the East Coast, and he'll tell you exactly where he's from and what he does once I introduce him. But our episode title today is Helping Our Children Become Even Better Than They Are. So, Barry, do you want to take a moment and tell us a little bit about yourself and then unpack what you mean by better?
Yeah, that's a good question. What do I mean by better? Well, first of all, I'm a specialist in orthodontics. I had been, and it's been over 40 years that I've been in practice. After the first 25 years of being in practice, I started asking some questions that led me down a rabbit hole that I'm sure everybody that's watching this podcast has climbed into if they're members of the AMR or if they're in dentistry, or even if they haven't climbed down the hole, they've heard about it. And that is that the orthodontics really is not so much about teeth as it is about all the origins of malocclusion. And I started questioning that after hearing some idea that the etiology of malocclusion is not about the teeth, but about soft tissue function. And that soft tissue dysfunction is really what causes malocclusion, not genetics. Even though genetics are involved, we're going to be talking about this concept today of epigenetics, which is how our genes are expressed in the face of local conditions. And I know Mark and I have talked about this for as long as we've known each other. In fact, meeting Mark happened at Bill Hang's BioBlock course. Oh gosh, it's got to be 12 years or 13 years ago. We met on the first day, had lunch together, and have been fast friends ever since. And on this road together. Um, and one of the things that has changed for me really is this major paradigm shift about how orthodontics really is not so much about straightening teeth, but handling those preconditions to malocclusion. And the preconditions not only lead to crooked teeth, but they also lead to significant health consequences. And so that's what we're going to be talking about today, because in our conversations leading up to this particular podcast, we're talking about how do we make kids better. So the question of better is it's a loaded term.
Right?
Is it better than what? Is better perfect? Is better less compromised? And I thought maybe talking about this today would be just a terrific topic,
Well,
for
I totally agree. My kids are grown, but I'll have grandkids, and I'm going to be paying attention to them very, very closely. My wife is a competitive ballroom dancer, and a lot of kids are in that competition as well. Very, very accomplished young, children, and so many of them are just world-class level, yet they're obviously fraught with airway problems.
Mm,
Obviously, it's so clear, and I just only think, gosh, if they're that great. With the compromises they're dealing with, imagine and just imagine how much better they would be. And
yeah,
so, that's always, it's like, hey, my father lived to be 86. It was a ripe old age, but he had, undiagnosed, untreated sleep apnea. If he had had that aspect of his airway condition taken care of, he would have maybe been alive today.
yeah,
So
that's
we
right.
just, it's a real thing, isn't it? And it's kind
Yep.
of a scary thing to think that we can't get people better
Yeah.
unless we it's like we don't know what we don't know, right?
That's
So,
right. And
yeah,
what we often know is what's in front of our face.
yep,
And maybe stretching that a little bit to what we learned in dental school and what we see in practice every day and what our services can handle. And we get focused in, much like most medical specialists, we get focused in on the thing that we do and what we see, and we think that that is the complete picture. So we look at crooked teeth and we say, well, we can put braces on, straighten the teeth. That's how we were taught. And that's the culture is still really oriented to that. But it requires taking a step backward and start looking at a bigger picture. And you can step back quite a bit. The more you think about it, the origins of life really are very interesting. But just focusing back on the last 500 years of human history is enough to show that there have been some significant changes in our physical being that have come about because of changes within our culture. And the things that we have been doing to advance humanity, while wonderful in so many ways, have also had some unintended consequences.
right,
So, I say I don't really want to go back to the savannah. I don't want to be a hunter and gatherer other than having to circle around the perimeter of Whole Foods. And I love the shelter, the food supply, the transportation, the convenience. We can even get into AI now and talk about how it's going to change our world. But there have been unintended consequences that have been affecting our health. And the consequences are starting to pile up in a way that we're starting to take big notice of them. And these consequences are, you could put it in a big category of the chronic non-communicable diseases of Western civilization. And they have been getting more intense, more frequent, but the scary thing is happening at earlier and earlier ages. And so even as late as I think it's like, I don't know, 2017 or something, World Health Organization came out and said that these chronic diseases are the number one threat to our health. That's globally. And you listen to people like Casey Means, and I have a little clip of her if you want me to play it. She's an ENT who also went through a major paradigm shift, giving up on her surgical training because she realized that all she was doing in nasal surgery was uh, taking care of symptoms and not really addressing why the symptoms occurred.
I,
And
yeah, and sorry to interrupt, Barry, but I
yeah,
think
sure.
it would be great to do a couple of things to make sure that those who don't understand the term epigenetics, and trust me, there are a lot of healthcare providers that really are not familiar with the term. They really
Uh,
aren't. And when people are asked a deeper question about a malocclusion, for example,
yeah,
the healthcare provider, board certified or not, or whatever,
yeah,
it will likely say, well, that's genetics.
yeah,
And then everyone just accepts that, and that's the end of the discussion, which is
yeah,
very interesting because it really speaks to your intro comments about we just treat what we see and we
yeah.
don't ask that question, well, why did that happen? And
Why?
the answer to that why seems to be genetics, genetics.
Yeah,
And it's interesting how everyone just at that point, when you make that one word known, there's no further questions. And so
yeah,
that's kind of an odd thing. And I thought it would be great for you. Pull up that video anytime you want. I've seen the video, it's excellent.
yeah.
But if we can kind of move a little bit into epigenetics, maybe in a more granular way, give a few examples of what what's changed because here's the thing. It's happening to so many people, and it's almost becoming the norm. It's like we don't even know what we're supposed to look like or how we're supposed to function. We just sort of know what we become. To the point where, even in dental school, when we make the arches to work on the teeth, we have these plastic teeth. All of those arches are made oftentimes in a constricted way. Our understanding of beauty, maybe even, or whatever the case may be. But I would love you to pull up the video anytime you want. I'm going to give you the floor, and if you can get into the epigenetics and modern environment for us, I think that would be amazing.
So I love this slide. And tell me if it's coming through all right, if
Oh,
this looks
perfectly.
okay on
Yeah,
the
yeah, looks great.
screen.
Looks great.
This was derived from a title slide from Economist magazine some years ago, talking about evolutionary medicine and whether we're developing the way our genes have been, programming us to become over the millennia. And I have the name of all these anthropologists and dental scientists from the years, looking at this, and this knowledge is certainly not new. But the idea that if we were derived from the great apes and have been improving because and in our ability to survive and reproduce and produce children that are viable enough to have children of their own to propagate the species and so forth, that in recent times
Wait,
some
gotta go back to that one.
some oh, oh let me see, does it stay?
Yeah.
Yeah. So something has been happening to us that it doesn't look like it's evolutionary, um, you know, an evolutionary advantage. In fact, it could be said that we are devolving. And regarding dentistry, we understand that just 500 years ago, we had straight teeth. The anthropologists will show in ancient skulls that maybe, oh, I don't know, 5% of skulls will show some irregularity in the teeth, usually, some crowding of the lower anterior teeth, but very little else besides that, that humans had room for 32 straight teeth. Richard, can you imagine that?
Oh,
That and space behind the third molars.
yeah.
That's what you see on ancient skulls, pre-industrial skulls. But something has happened that has changed that. So this thing about epigenetics, let's see, my title is covering that. Let me correct that just for a sec.
You got it.
I made some copies here. So this thing with epigenetics suggests that we do have genes for straight teeth, but something is getting in the way and expressing our genes in ways that lead to different outcomes. So epigenetics suggests that our genome has a limited number of genes that can be expressed. Many of which, though, are unavailable for replication because of the way the genes are structured, the way the DNA is structured, and that there are mechanisms within the chromosome to unravel or unravel certain sections so that they would be expressed or not expressed, and that the controls that determine which ones are available and which ones are not for replication comes from local factors. Now, local factors are things that are in the environment, either generally or specifically within our bodies, that make these changes. And so the kinds of things that have changed for us um, are what is leading to these chronic non-communicable diseases. So early childhood development, and this, we look at this in great detail in this new area of airway orthodontics. What's going on in utero? What's going on during birth? What's going on right after birth that might set in motion a change in the way that the facial bones grow? So that by the time teeth come in, there's either enough room or not enough room for them. Teeth don't really know how to come in crooked. That's, that cannot be genetic. They follow a path of least resistance. They're literally playing musical chairs to try to find a place to come in. And it's no wonder that they don't come in straight, because the containers that hold them, the jaws, are just not developing the way they should. Environmental chemicals, not just chemistry. Our body's also an electrical kind of being too. So the fact that humans are surrounded by an electrical or electromagnetic environment that did not exist more than 100 and some years ago, it is rather remarkable. The things we use for our health, especially with drugs and pharmaceuticals, but also the way we use our bodies, the way we balance against gravity, the way we hardly look out into the horizon anymore because everything's right in front of us. The things that we eat, the way that it's made, that might require less chewing than it did when we were eating roots and fresh meat. So many things of our environment have changed, and frankly, with all this talk about being so convenient with new technologies, our lives have become this unrelenting pursuit of happiness and perfection that really is stressful in its own right.
So true.
Um, and I, I know I mentioned, well, let's listen to Casey Means for a second, and then
Right. And then
I
we can get to what we know we want to talk about is that movie, right?
yeah,
Yeah.
because
We'll get there.
all
Okay,
right,
so
all
everyone
right.
just stay with us because it's going to get really fun.
Yes.
Important.
So Casey Means, I mean, she's just a brilliant speaker. I took some clips and put them together. This was from a podcast that she was doing, and we're going to pick up where she is describing what's going on in our health in our country right now.
Percent of teens now have prediabetes. This was a condition that no pediatrician would have seen in their lifetime. We have 18% of teens with fatty liver disease, a disease that used to be in late stage alcoholics. Cancer rates are skyrocketing in the young and the elderly. Young adult cancers are up 79%. And this is the first year in American history we're estimated to have over 2 million cases of cancer. 25% of American women are on an antidepressant medication. 40% of 18-year-olds have a mental health diagnosis. We have the highest infant and maternal mortality rate in the entire developed world, despite spending 2x on infant and maternal care than any other country. Autism rates in kids are 1 in 36 nationally. This was 1 in 1,500 in the year 2000. In California, 1 in 36. Right now, it was 1 in 1,500. In California, it's 1 in 22, one of the worst states in the country for autism. So go on and on. Autoimmune diseases, infertility is at peak rates. I mean, I don't know how this is not front page news. Infertility is going up 1% per year. Sperm counts are going down 1% per year. 26% of women have polycystic ovarian syndrome. Now, the thing that people need to understand is that all of these conditions are caused or driven by the exact same thing, which is metabolic dysfunction, this core foundational issue of how our bodies on the cellular level function, which is driven by our toxic food system and our toxic environment.
So, isn't there so much to unpack in
Oh,
that
yeah.
that bit of a presentation. And the truth is that it is an existential crisis.
I agree.
We are we are headed toward um, a situation where we are not going to be able to be resilient enough to have children that are resilient enough to have children. And we do see this. If 1 in 21 children have autism, and I'm sure there are many autistic kids, especially if we learn how to deal with it, that will be able to have children. We may be able to turn this thing around. But many of the autistic children that I now treat in my practice will not be resilient enough to find a mate, to be able to marry, have children, support them, teach them, and have them become, viable humans themselves. It's just not going to happen. And on this trajectory, it seems to be going way downhill. We are in a downhill spiral in that way. And so when we ask this question, how are we going to make children better? It's it's a it is an existential question. And it's pretty frightening. One of the first people that I talked to as I was changing my mind was Joy Moeller. You may know her because she's one of the matrons of myofunctional therapy. She practices there in California. She was good enough to answer a query that I had when I first heard of this thing about soft tissue dysfunction. And she, in our very first conversation, she said this. She said, "We are on a downhill spiral." And I kind of appreciated it when she said it, but I thought maybe it was a bit hyperbole. Now, just some years later, I understand that it really is a big threat. So, in many of my lectures on airway dentistry, I talk about this big picture because it's easy to get frustrated by the little details of trying to help kids get better.
Mm.
The idea of epigenetics is that oftentimes it's our habits that are leading us to trouble. In airway dentistry, we all know that mouth breathing is probably one of the most damaging things you can do
Right.
to your face, to your teeth, to your body, to oxygen delivery and all that. And the kids that come to me, whether they're on the spectrum or even on the low end of the spectrum or not on the spectrum at all, at least the way we're defining it now. I mean, frankly, I think we're all on the spectrum in one way or another. But many of these kids have behavioral, downstream behavioral problems that make it very difficult for them to change a habit, to even understand what a habit is. And yet those are the kids that need us the most. So it's very, very different. This is not the easy way to practice orthodontics, I'll tell you that. And yet, if you have this big picture in mind, it fortifies you to understand that what you're dealing with is not crooked teeth, is not dentistry, is not just, the local environment. It's this big picture. There's I didn't put it in my deck for today, but there's a group that I have been following for a long time called Documenting Hope. It was developed by a woman named Beth Lambert, who was a mother of 2 kids with terrible allergies, the kinds where they can't sit next to a kid that's eating a peanut butter sandwich, or they have to have an EpiPen available and that kind of thing. And which can be an existential threat in itself, right?
Sure,
I mean,
absolutely.
anaphylactic shock can be pretty
100%.
scary.
Yep.
And she worked them out of it by using a combination a functional approach, systems-based approach of trying to reorient the inputs to the body. Well, and it was diet, and it was exercise, it was lowering of toxic exposures, reducing the toxic load, as she will call it, and found that she was able to help her kids and dedicated herself to helping others as well. Well, if you go to her website, documentinghope.com, she has a introductory video there about her program. And by the way, her program, well, there are several parts to her program, but one part is to establish a clinical study. Originally, it was for 14 kids with chronic disease over a period of 18 months, where we throw the kitchen sink at them. Everything that we know about either building resilience or lowering toxic load, put the kids through everything that's available or that seems to be appropriate, and see how well they do after 18 months. And the results so far, I mean, she's only because of the cost of doing these studies and validating the studies and so forth. In a way, she's just getting started with this, but there's at least anecdotal evidence that suggests that we can work kids out of this by changing the original conditions. And that's incredibly heartening, that even within one generation, you can at least make some change that helps kids be healthier. Now, in practice, you're not going to make every kid perfect. And this is so hard for dentists to understand. You know this, Richard, how we were taught in dental school. If we had a margin that might have had a microscopic leak, if we did not have apical fill in a root canal, if we didn't, there's so many examples, cut our preps right, we failed. We are so oriented towards perfection.
True.
That dealing with the bell curve of results that you get with work, like helping kids get better, can be a very frustrating and sometimes demotivating factor in having people learn this kind of practice. Now, physicians have been used to that for years. Because, I mean, they know that they're going to maybe help somebody with a symptom, but they never say, I will make you perfect. And they have no compunction about saying you need this procedure again and again and again, and charging for it every single time. Do you think we do that in dentistry?
Oh, no
Oh
chance.
my God, if we seem not to have done it perfectly, we take it on ourselves, we redo it, we start living with these patients, and it's just a very different way of thinking.
I'd be interested in knowing where the parents fit into this whole formula, and because what we're seeing in our practice with our evolving airway practice is that uh, we may reach out to the parent because they're a friend and we're concerned about their child, but they had no concern. And they reluctantly bring that child to us for assessment. And eventually, slowly, they overcome their skepticism. But I mean, I imagine you have a reputation that brings them in. They already know if you want to get your airway taken, this is an airway problem or something, the word's gotten out, they'll come to you specifically for that.
Yeah.
I mean, but I would imagine that there are parents listening that are wondering, what should I look for and what can be done about it in my child?
Yeah.
You mentioned, but I'm sort of looking at that kid with the droopy eyes, with the open mouth and elongated face. It's allergic to everything. That was really great at first, but now he's doing poorly in school, and they're going to the school psychiatrist, and they're thinking about Adderall prescription, and there's a lot of controversy, and grandparents are involved, and they're giving them one piece of advice, and now you're just another person. This is kind of real life. This is what we're seeing. But these types of kids are everywhere.
Yeah, they
Very
are.
weird. I go to Costco and it's like they're full. It's full of kids that have these exigent needs for intervention.
Yeah.
So what can you do to help those listening that might be parents to consider getting something evaluated?
Yeah, I mean, you bring up exactly the issue, and that is we need to go through a cultural shift
Right.
where we're not looking at teeth, that we understand that there's a bigger problem afoot. And when we do, then we will be able to say we are dentists that happen to have some skills that can be very helpful in remediating these problems for kids. Um, Dentistry, fortunately and unfortunately, became separated from medicine 100 years ago.
Right.
It was fortunate for us because we were able to maintain a certain amount of independence in what we do and how we practice. And unlike medicine, we are not necessarily under the thumb of insurance companies that are dictating how we diagnose and what we do about
Or
conditions.
hospital administrations and big companies and things like that. Yeah, that too.
Yeah, well,
Although that seems to be shifting now.
that can be shifting, but at least up to this point, those of us in
Right.
private
Right.
practice have maintained a certain amount of independence, and it has allowed us to become curious about this particular issue in a way where we are the tip of the spear,
Hmm.
on these in this area. And but the bad thing is that in the eyes of the public, we are separate from medical care.
True.
So if we say, and this happened to me early on, I told a mother who brought her kid to me with a crooked front tooth, and I saw all the things that you just mentioned. And I told the mother, your son is really sick. And she took his hand, she walked out of the office and never came back.
Wow.
And the poor kid, maybe someday she did find an orthodontist that straightened that tooth. But I'm quite sure that he was also burdened by another of, neurocognitive attention deficit problems, breathing problems eventually, and sleep, all that kind of stuff.
Wow.
And it was an object lesson to me because I had to learn how to talk to people who didn't really see that bigger problem. And, it takes a little bit of a finesse and a little bit of heart and compassion to understand where people just are not oriented to think that way. And I can't be judgmental because I didn't think that way either for 25 years. In fact, there have been a lot of people, whose shoulders I now stand on that I had ignored for years because I didn't believe what they were saying. It just didn't jive with the orthodoxies that I was taught in my orthodontic education. And so, and I love talking to orthodontists because having been an orthodontist and having made that shift, I know what it takes. And we do have skills. We have great hand skills. We have material skills. We know how to treatment plan. We know how to think through problems. Not to brag or anything, because it wasn't true in my day, but orthodontic residents, they're usually the cream of the crop. It is the hardest residency to get into. These
Still
are
true
not,
today. Still true
they
today.
are not dumb people,
No.
but we're just so oriented towards the wrong thing. So culturally, our society is generally oriented towards the wrong thing. And, unfortunately, crooked teeth are the wrong thing. I mean, they are the canary in the coal mine. This is the way I look at it. If you see someone with crooked teeth, that's actually the body's solution to a problem of imbalance in the rest of the body. This was Dave Singh saying it this way, and I think he really nailed it on the head. malocclusion is the body's way of seeking equilibrium and homeostasis. So that if you see crooked teeth, it is de facto a pathognomonic for some kind of imbalance. It may be local in the mouth, a soft tissue dysfunction. It may be a little bit bigger cranial strain or postural strain, or it may be a toxic overload. And as the body is built, sometimes head to toe, there can be postural problems and functional problems of all sorts.
Right.
And um, and and um, and just being focused on the crooked teeth as an aesthetic problem is kind of short-sighted. But that's where our culture is, right? We
Right.
want purple hair and green contact lenses and teeth so white they look like chiclets.
Right.
And they've got to be straight so we have a beautiful
Right.
a beautiful prom picture, and they give you confidence, and they and I mean, some of that's legit, right? We want to
Right.
look pretty nice, but over and above that, it can't take priority over our health and well-being, not for much longer,
Right.
because as I say, this is an
You know,
existential.
I think about this often, and it's why did the body grow this way? Because we're talking about growth, altered patterns of growth that were brought on by epigenetic, stimuli.
Yeah,
But doesn't the body have some intelligence built into its genetics that overcome this epigenetic drive to allow us to survive? And it's interesting because a lot of these compensatory growth changes are done because we need to improve our airway,
right.
and yet they end up costing us in the end.
Yes,
I
that's
think
right.
that's sort of the great paradox about it.
Right.
And oftentimes that kind of a question comes from a parent too. Now,
Yeah.
wait a minute, wait a minute. His father was just like this.
Yeah.
And the brother's just like this. And I'm thinking, well, of course they're just like this because the environment,
Has
is the
been
same
several
for all you
generations.
guys,
Right.
right? And so they don't quite want to sort of be okay with this
Yeah.
sometimes. They want a simpler, straight in the tooth kind of approach to things. Is
Yeah.
there any way you can just the real fundamental ABCs of growth that end up creating an environment where the teeth are pathognomically letting us know that there's an imbalance? I mean, what can you take us down maybe one example of
Yeah.
seemingly perfect child is born? What went wrong?
Right. Right. So let's make it as simple as possible.
Right.
This
Yeah,
concept
just
of
super
soft
clean.
tissue dysfunction. I'll tell you, first of all, I'll tell you how function works um, genetically and functionally. And that is, in the mouth, there are really four things that you have to do from your time you're born, as you're growing and developing, that will help your face develop as well as possible, with the jaws growing as well as possible, and then have enough room so that the teeth can come in straight. And they are: number one, your tongue has to be resting up on the roof of your mouth for, oh, maybe it's even a third of the day. But when you're not talking or eating or opening your mouth, your tongue should be resting on the roof of the mouth. Why? Because it actually serves as a scaffold for the way the maxilla grows. So if the tongue is resting on the roof of the mouth, it has the support that it needs to grow broad and wide and forward. Secondly, you have to have your lips together in order to keep your tongue on the roof of your mouth. You can experience this if your lips open, or if you open your mouth, generally the tongue will flop down and not be on the roof of the mouth. In order to have the lips together, you have to be able to breathe through your nose. And that this becomes, frankly, one of the first things that I look at, and one of the first things that I help kids do. Even though I'm an orthodontist, pediatricians are not doing it, ENTs are not doing it. You have to teach a child how to breathe through their nose using their diaphragm, breathing at an appropriate rate and volume to deliver oxygen adequately and efficiently to the rest of our body. So tongue on the palate, lips together, breathe through the nose. The fourth one is learn how to swallow in a physiologic way, which is having the tongue also on the palate where it sequesters the liquid or the food, and then you just use your sublingual muscles under the tongue, in the throat. They pull down the sequestered liquid, is now in a vacuum pocket. It gets pulled down the gullet and down our throat, which is great. I mean, it's a kind of mechanical dance that these muscles are doing. But if those first three things didn't happen and it's difficult to swallow, you now have to recruit your facial muscles to help you out, particularly your lips, your chin, your cheeks. In order to be able to swallow with a tongue that's not up on the roof of the mouth, you better clamp these muscles together so that the food doesn't come pouring out the front. It's a little bit of an oversimplification, but you see that in babies, right? When you put a spoonful of food in their mouth, they're still used to pushing the tongue forward. Half the food spills out the front of the mouth, right?
Right.
But eventually they learn how to clamp their lips together to keep everything in there. But if they're not using the tongue properly, those clamped muscles will make the teeth crooked. They crowd up the front teeth, they make the arches narrow, they distort the formation of the alveolar process, the part of the bone that carries the teeth. So there you go. Breathe through your nose, keep your lips together, have your tongue on the palate, and swallow correctly. Those four things. Now, what can go wrong? Well, first of all, you may not be able to breathe through your nose if you're highly allergic, or you have frequent colds or congestion, or you don't, mom doesn't know how to clean the nose. And it's just so easy to get into a cycle of leaving your mouth open because, frankly, there's nothing more important than breathing. If you can't breathe through your nose, what else are you going to do? And I'm going to follow up with this by something that Casey Means said in that earlier clip that we played. But those four things are so simple. They're simple to see. They're easy to do for most people, but sometimes there's obstacles in the way. So the answer to your question is yes, the body has the wisdom to grow properly with 32 straight teeth and plenty of room for airway and breathing. But something gets in the way. So the way we take care of the body is we try to remove those obstacles and we let the body's wisdom play out. This has been something that chiropractors have been saying for 125 years. Cranial osteopaths have been saying for 125 years. Naturopaths have been saying for a long time that we need to know the body's wisdom and just be there to support it. So once people start learning that, it's going to be, under that cultural shift. So let me say this, Rich. Thanks for humoring me here. That so Casey Means said, all of these chronic diseases have an origin in the same etiology, and that was mitochondrial dysfunction. So in other words, most of them are a metabolic problem. Well, crooked teeth also have a single etiology, and that is not being able to do those four simple things. Now, this is why mouth breathing really is such a dreadful thing. It changes the way the face grows, and then teeth can't come in and so forth. But here's the point that I want to make, because there's a lot of confusion about chronic disease in medicine. Everybody thinks that their disease is their disease. It's a kidney problem, it's a heart problem, it's a sleep problem, it's a whatever it is. Well, in orthodontics, the corollary is we judge things based on the angle classification. The angle classification is a description of how the top and bottom teeth come together when you bite down. And orthodontists are taught that every angle malocclusion is a different nosology, meaning it's got a different origin. It looks differently diagnostically, and it requires a different treatment approach. And yet there's some evidence, and I believe that evidence, that the etiology of all the different malocclusion angle classifications of malocclusions that come from the same thing, and that's not being able to keep the tongue on the palate with the lips closed, breathe through the nose, and swallow properly. One of the evidence bases for this was this series of experiments that was done by Egil Harvold, originally European, came to Canada first, then the United States. He ran the series of experiments where they took juvenile monkeys, a dozen or 14 of them or so, and he plugged up their noses and just watched how they grew. Simple enough experiment.
Right.
Of the cohort, one of them, frankly, couldn't figure out how to breathe through their mouth and suffocated. Because of this is not an experiment we can readily repeat anymore. But it's kind of precious in the outcome, because all the rest of the monkeys, their faces started to change shape, their teeth got crooked, but many of them had different kinds of results. Some of them had anterior open bites, some of them had cross bites, they had narrow palates, distorted faces. And if it was left long enough, those changes became permanent. I read that as an orthodontic resident, and I said, it's kind of interesting, but they can't all have different kinds of, malocclusions. There must be some genetic difference.
Of course.
And of course, that was controlled for in the cohort, but still, it just didn't make so much sense, and I had to ignore it at the time. There's some of these things give you cognitive dissonance that you just kind of have to ignore or explain away or get defensive about. Can't be, there's no evidence, I don't have to give me the evidence, it's only a small sample, blah, blah, blah.
Yeah, we hear it all the time. I wanted, if you could allow me to just kind of pull this into a skeptic sort of mindset. We cannot change the environment any day soon, and it doesn't look like a lot of things are going to change. I mean, we're not going to be able to change the what Monsanto or some major food manufacturer does to their oil or does to their ingredients and things like that. And there's only so much we can do to avoid. And I don't want to make this podcast about avoiding bad foods or something like that. I don't want to do that, but I do want to sort of just move back just a little bit in time. The kid's got a stuffy nose all the time. He breathes through his mouth. How can you get him to breathe through his nose when he's allergic to four things? And this is just the way this kid's been for a long time. I mean, because I can hear a parent saying this to me, and then even if we do have an intervention which involves nasal hygiene and we maybe create some more of a larger nasal fossa volume, or we get the valves opened up and whatever we got to do. The environment's still there. I mean, what's going to keep this from moving back? Or the new word for orthodontic retention not the retainer, but how do we keep the behavior healthy so we don't see a relapse?
Yeah, I mean, that's a good question. Look, um, the first thing is to take an idealist's view of the
Mhm.
problem.
Mhm.
You have to. It's too easy to write it off, and most orthodontists, frankly, they don't want to bother. We have spent decades trying to invent gadgets and gizmos that take cooperation out of patients' hands because we want to be efficient. We
Right.
want to be we in time. We want to be we want things to be friendly. We want to be profitable. But unfortunately, if you don't deal with behavior, you back yourself into a corner where all you can deal with is what you can deal with mechanically. And because behavior is the etiology of the problems, if you don't change the behaviors, you're not going to change the outcomes. You can see that written on the walls of gyms. You can hear that in weight loss programs. Everybody knows that you have to change the underlying conditions.
Well,
And
Plato, the great Greek philosophers said this, thousands of years ago. I mean, it was I mean, it's 100% true.
yeah,
Yeah,
so and unfortunately, humans were not really that good at long-term thinking, and
apparently
that
not.
really is a problem.
Yeah,
Frankly, I'm wondering about AI because AI will not forget and will be able to put us on a trajectory that keeps pace with advancement. And so, that's a whole nother topic.
oh
And
yeah.
actually, it may be this is where we'll finish off this podcast with my little anecdote here with that movie.
Okay.
But we cannot get discouraged and say it's not possible to change human behavior. Our behavior has changed. Maybe it's changed for the worse, but think about this, Rich. Have you been on a plane lately that's filled with smoke?
Nope.
No. Have you been in a restaurant that's filled with smoke?
It's
Nope.
it's
Have
hard to
you been
believe
in
it
art?
actually did. It was that way, right? It's hard to believe.
It was. Have you ever
Yeah.
been in an orthodontist's office that's filled with smoke?
Don't tell me they were
My dad was an
smoking.
orthodontist.
Don't tell. You gotta be
When
kidding
I
me.
was a kid, I was working for him doing models and tracings as
Right.
like a 14-year-old. He had four chairs lined up, and he would complain to me, he goes, I light a cigarette, I take a puff, I put it down in the ashtray in the lab. The lab was no further away than the back of your operatory there from the chairs. And he goes, and then I go out and I treat a kid, and then I come back, I got to light up another cigarette. I mean, it. This is like in the 50s.
Mind-boggling.
Oh, it is mind-boggling.
Yeah.
So what happened? Humans changed behavior.
True.
Why did we change behavior? Because finally we understood that we were being the victims of a marketing campaign designed to sell tobacco.
Bingo.
And once we got over it, once we got that understanding, we got over the behavior. Maybe not entirely, but to enough extent that we're much healthier for it. Well, the same thing's going to happen with mouth breathing. I'm telling you, as mothers start to understand that the problems that their infants are having do not just go away like the pediatricians say they will. They morph into other problems. And
Right.
then as toddlers, and then the toddler's behavior morphs into other problems as teenagers, and it morphs into problems like sleep apnea as adults, and chronic disease and heart disease, cardiovascular disease, diabetes, fatty liver disease, and all that list of chronic problems. We have to change our culture, and that's how it's going to happen.
Wow. And it's going to take time.
And it's going to take time, but it's got to start now.
Yeah.
So, are you as old as I am? Were you a hippie or just a bit younger?
I don't know. I
You
was
grew up in
I was born
California,
in the
right?
50s, so yeah, I
Yeah,
was
yeah,
in the
yeah.
50s.
And you were you're in the land of peace, love,
Oh
and
yeah, you
yeah.
got that right.
So one of the maxims of the time was think globally, act
Act
locally.
locally, absolutely.
Right. And that's the answer.
Yeah,
You can change behavior. I do it all the time. That's the first thing I do with my patients. And now, lately, before I ever think about straightening a tooth, I spend 3 to 4 months teaching about nasal breathing, nasal hygiene, how to deal with some of these, environmental stressors and so forth. And I won't even make a decision about how to help the jaws recover or teeth come
right.
in until we do that. So
Well,
and I talk till I'm blue in the face with these
right.
these parents and the kids, and they don't get it, but they get
Yeah,
it. I mean, they
yeah,
came for it. They came for it, and they don't get it.
right.
So it's just different. I don't know. We're more like teachers now than we are mechanics, is the way I'm looking at it.
I would agree. I would
And
totally agree. Do I know we're kind of coming up on the end of our time that we have. So
all
do
right,
you want to
let me just play this because
give
this
me
will
the
be fun.
Wally metaphor? I mean,
Yeah,
I would love that.
yeah. That's what I want to do. So when you talked to me about this, I immediately went back to a memory that I have of this movie by Disney Pixar. Brilliant, brilliant movie. And when I first saw it, I saw it with my kids and I thought it was cute and this and that. It's kind of a love story between two robots.
Right.
But the backstory is
Oh,
what now is so prescient
yep.
and genius that when we started talking about it, I because it's been like this faint memory, poking me, and I haven't really thought about it. But then our conversation happened. I went back and I watched the movie.
Oh, you did? Okay, because I
So
wanted to watch it again too.
yeah, and I don't know, are we allowed to? I did
I don't think it matters. I
screenshots.
don't think Disney's going to charge you.
I'm giving them credit. This is
I,
all from Disney's Wally.
right.
But so here's the premise behind it. Um, B&L is buy and large, meaning buy anything that we will sell you that will make you happy. And you see all the things, the food, the sugar, the dopamine stimulants. And it became so much that junk piled up on Earth enough to make it uninhabitable. Behind all these ads, you see the mountains. Those are mountains of debris that this little robot's job is to stack up. In the meantime, Earth became so uninhabitable that B&L decided that they were going to create an escape hatch for us, which was essentially a um, a spaceship that we would go into. And of course, B&L took advantage of the marketing opportunity
Of
to
course.
create the spaceship. And the spaceship promised that you would live in luxury, that every need would be taken care of, that even Granny could sit in a roving chair and not have to walk. And it reminds me of how Elon Musk has been talking about AI as changing the need for us to even work. We won't need jobs. We won't need money. We're going to have everything provided for us. And it all sounds so good. But in reality, what happened was that in the movie, the 700 years of, what did they call it? The 700th anniversary of their 5-year trip,
Right.
because they couldn't clean up the earth enough to go back. That this is them selling it as space being the final frontier. But it didn't turn out so well because with all the let me just close the door for a second. I don't know if you can hear the dogs barking.
Oh, no, we're good.
It didn't turn out that way because after these 700 years, the epigenetic effects on the human body were massive. And so were our bodies. Do you see how this mimics that initial slide that I showed at the beginning?
Yep.
And that here we are floating around because we cannot even walk anymore with a screen in front of us. And that's exactly how we are. Who can resist pulling out the phone at any dull moment of our day?
Yep.
And it literally changed our biology. So you could just snap your fingers and a soda or a burger would appear, and we're not eating healthy. And this is what's become of us. And so in the movie, they show
Yeah.
the captains of the ship. And on the left, this is at the first year was 2105. So we're not quite there yet, right? We still have plenty of garbage to fill up our earth with. But you see the picture of, this handsome looking captain. Notice over his left shoulder is this thing that looks like a steering wheel. That is the interface for the artificial intelligence that's running the ship, taking care of the people. And notice how each generation of captain, they tend to get a little more robust or busty, I should say, and fatter and fatter and fatter. And this one at the end, Captain McCrae, is the current captain in the movie. And 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 there's a moment there where they're about to recover, but the the AI says, due to the effects of microgravity, this is 700 years, you may have suffered some slight bone loss. And at the end, of course, they are going to they are going to find their way out. There is a happy ending where how does it happen?
They're forced to
discover
walk, right?
they're forced to walk, and then eventually they become healthy again when they come back to Earth. So
Right.
it is a happy ending,
Of course.
but they oh, the AI says, well, you may have to learn how to walk in order to gain your bones back. But we know it wasn't quite as easy as it was. It's easier said than done. But anyway, that's what we need to do. We've got to get back to the garden.
Well, I totally get it. I appreciate it. You've got your hands full. I mean, you can't retire anytime soon because you've got so much work to do. I mean, it's like, well, if if you and I decided to retire, and we certainly could do it, I would feel so restless that I wasn't doing kind of what I've discovered is probably my mission in our profession.
Yeah, that's
It's
right.
really, I teach a lot of courses, and I'm looking at my whole curriculum. And I'm like, my gosh, I can hardly even teach these courses anymore. The way I've been teaching them, it's just not right.
Yeah.
As it fell into the traditional, treat what's in front of you problem, even though I like to think, oh, we like to go a step deeper and go beyond. But it wasn't, to be honest, it wasn't at a deep enough level at all.
Well, let me give you a little bit of hope here,
Okay,
Rich.
good. I want some hope.
Yeah, because we have been at this for a while. Certainly Mark and I stand on other people's shoulders who have been trying to tell us this for a long time. This summer, I was able to participate in an event here in New Jersey,
Oh, nice.
which was run by the New Jersey Department of Health. And we
Wow.
have it fairly conservative compared to a lot of states. And it's a complaint of mine that I cannot, for instance, hire a speech therapist or a physical therapist or an osteopath to be part of my practice.
Hmm.
Dentists are just not allowed to do that
Hmm.
And I'm not going to say because we're second class citizens, but because we're apart from medicine.
Right.
And here we now have this event this summer designed to bring dentistry and medicine back together. So if that's a bellwether of where we may be going, then I think that's going to be great. And I do see changes in Washington, whether people like it or not. There's certainly plenty of room for controversy, but we do now have a government that's starting to pay attention to us
Yep.
and to this topic. And then the other thing is, yes, I want to retire. If there's anybody listening to me that wants to become part of my practice and take it over, I got a lot of teaching to do because teaching is really where we have to go. We can't retire because we have to be able to do this. And the Airway Collaborative is going to be one of the ways that we're going to help people do this. The Airway mini residency talks about the why and how to see it and what to do when we see it and what the different interventions are. And believe me, there's no one gizmo or gadget that's going to be used for everybody that's going to solve the problem. The
Correct.
companies that are selling, one way of doing it, I think are a
Oh,
little short-sighted.
yep.
And then how to work together. It's just so important that it is not a siloed affair, that there are many ways that kids need to approach this. And we have to make it practical as well, and then help people see what comes next.
Well,
So that's where we're
well,
that's where we're going with it.
I love it, Barry. You've been most insightful and really helpful. I've enjoyed spending this time talking to you.
Thank you.
We have got
Likewise.
so thanks, and we have so many topics yet to cover. And I know in the future, Mark has told me that you and Mark will run the show for a while, or you'll have the podcast with a guest on, and we'll keep putting these out. We're putting out one a week, and we're going
Yep.
to do it, and hopefully we can, get the message out.
And this is how we make the culture different.
Absolutely. I mean, it's
And
it's kind of the cultural evolution has caused this problem, right? I mean, it's a
yep,
cultural evolution. It's a
yep,
fascinating term, something I
yep,
wouldn't have understood a few years ago, but today I totally get it.
yeah,
And
yep, yeah, yeah.
yeah, I've appreciated the time with you, man. And
Good.
we'll talk soon. And I guess this ends our session. We sometimes end the session with a teaching moment or a learning moment,
Yep.
something that kind of happened along the way. And I guess we might want to kind of reflect back on that movie, Wall-E. I mean, I think if you haven't seen the movie, you got to see it. As an adult, watch this movie and understand that what Barry did was give you a really good synopsis of the movie. But once you really see it, it's very powerful.
Yeah, yeah.
The writers of that movie, they had figured that out many
And
years
the
ago.
the kids will love it too.
Oh, they
And
will too.
like a lot of these Pixar films,
Oh
there's that
yeah,
layer of thinking that adults really appreciate.
exactly,
Yeah.
exactly. All right, well, good night on a Saturday evening. I guess on the East Coast, it's about 5 p.m.
Yeah, and I'm
And
ready to take my wife out to dinner.
there you go. Awesome. Okay, thanks again for your time, Barry. And
Rich,
until next time, see you.
really enjoyed it. Thanks.
Awesome.